Coffee Corner with the Doc.
Hi everyone! Thanks to my early subscribers and those who emailed me with questions and suggestions. Once again, it's the Doc, and my content is based on my opinion and my experience. Today I will be speaking on some medications that have been suggested for the treatment of COVID-19. We know there are a few trials underway involving different techniques and drugs, but there's been a lot of buzz about chloroquine and hydroxychloroquine as potential cures for coronavirus. So, is this a miracle cure or is it just a myth? I'll make this as quick and simple as possible. I may have to do this in two parts though. I'll talk about the drugs, their risks, their benefits, their potential combinations, then I will give you my opinion. What is chloroquine? Chloroquine is a drug that was extensively used to treat malaria in Africa as well as other parts of the world. It's also been used to treat amoebic infections and many rheumatological conditions. However, due to extensive chloroquine resistance in malaria treatment, this drug has been relegated to the background for malaria. And then there's a related drug, hydroxychloroquine, meaning it's derived from chloroquine, and this is a form which is less toxic with fewer side effects than chloroquine. It's also used for the prevention and treatment of malaria in areas where there's no chloroquine-resistant malaria, as well as rheumatological conditions like rheumatoid arthritis, lupus, to mention a few. So what are the facts? 1. There is no robust evidence that chloroquine and hydroxychloroquine are effective in the treatment of COVID-19. However, both of them do demonstrate in vitro activity against COVID-19. By this, I mean that they act against COVID-19 outside the body. The second fact is that the current clinical evidence in favor of using chloroquine or hydroxychloroquine comes from a few small studies and anecdotal evidence. So, some doctors swear by it, and the number of doctors using these drugs right now is increasing. The third fact is the doses used for the treatment of COVID have not been universally agreed, and these drugs have been used in combination with other drugs off license or in clinical trials. And whether or not they're used is based on the risk aversion of the doctors, based on the policy of whatever hospital is doing a trial, and of course what the trial is trying to compare. Now, I feel the need to address these drugs a little bit in depth because there have been reports of people overdosing on chloroquine, and a few hospitals in Europe have had to actually stop giving these drugs to people due to the side effects. What are these side effects? Just headache, dizziness, tinnitus, that's a ringing sound in the ear, blurring of vision, gastrointestinal upset like nausea, vomiting and diarrhea, cramps, hypoglycemia. By this I mean low blood sugar. So if you find yourself sweating and shaking while on these drugs, you really should take a sugary drink and speak to a healthcare professional as soon as possible. And if you do have any pre-existing medical conditions like diabetes or heart disease, be sure to speak to your doctor first. In overdose, these symptoms may be exaggerated, and in addition, people may suffer arrhythmias. Arrhythmias are abnormal heart rhythms, and unfortunately, sometimes arrhythmias can be fatal, meaning they could cause someone to actually die. And it's this bit that worries many doctors around the world. Hydroxychloroquine and chloroquine can prolong the QT interval. The QT interval is a parameter in your ECG, which is a bedside test your doctor can do, which shows the electrical activity of your heart and helps your doctor to make an assessment of your overall heart health. So, if your doctor is to place you on these medications, it is a good idea to let them know whatever else you're taking, medications, herbal preparations alike, and for them to get a baseline ECG on you. I appreciate that this may be difficult in certain parts of the world where healthcare access or healthcare facilities are in short supply, so it will be up to the doctor to use his or her clinical judgment to select the right patient for the right treatment. Now going back to symptoms, neurological symptoms such as twitching, loss of consciousness, and even coma may occur in overdose. So please do not cause yourself any harm by panicking and taking these drugs without supervision. So what is my opinion with regards to the use of chloroquine and hydroxychloroquine in the management of COVID? I will be discussing this in part 2. Stay tuned.